So it is estimated that about 1.28 billion adults between the age of 30 to 79 years have hypertension. But what's surprising about this number is that half of this do not know that they have hypertension. So in today's video, I'm going to be talking about what blood pressure is, what it means to be hypertensive, what are those factors that can predispose people to high blood pressure, and how can you tell that you are hypertensive. Hi guys, my name is Melody and I'm a registered nurse. So what is blood pressure? Blood pressure is the force that is exerted on the walls of your arteries by the blood flowing through it. And this is measured in two numbers. One is the systolic blood pressure and the other one is diastolic. So the highest number we get when your heart beats is the systolic blood pressure. And then in between beats, when your heart is relaxed, we number is the diastolic blood pressure, which is usually the lower number. So according to the World Health Organization, the systolic blood pressure should be 130, while the diastolic should be below 90 of mercury. And we want this blood pressure to be not so high, and at the same time, we don't want it to be too low. Because if the blood pressure becomes too low, it means that our organs and tissues will not be supplied with blood. And then if it becomes too high, it can be detrimental to our health. So I'm just going to mention that hypertension is also known as high blood pressure. So throughout this video, I'm going to be using those two words interchangeably. When do we now say that someone is hypertensive? So for someone to be actually diagnosed hypertension, so there has to be like a consistently high blood pressure, which should be checked on different occasions, possibly different days and different situations for the doctor to actually finally decide that someone is hypertensive. So I'm going to make another video where I will talk about you measure your blood pressure to make sure you are getting the accurate reading. So what are those risk factors to hypertension? So we have the modifiable and non-modifiable risk factors. So the modifiable risk factors are those ones that are related to lifestyle, and if an individual makes necessary lifestyle changes, they can either prevent having hypertension or reduce their risk of having hypertension. So we have things like poor diet, like consumption of salt, processed food, or saturated fats. And then if someone is not having enough exercise, we also have other things like being overweight, alcohol consumption, poor sleep, or use of tobacco. So some of these factors, if people make adjustment, they are able to manage their blood pressure. And then we have the non-modifiable risk factors, where we have things like people who have family history of hypertension. So if someone in your family is hypertensive, the chances are high that you may also be hypertensive. And then we also have other non-modifiable risk factors that like kidney failure, people who are diabetic, or just any comorbidities that can actually predispose the person to being hypertensive. So how do you tell that you are hypertensive? First of all, it's important for us to discuss about the silent nature of high blood pressure. So we've often heard that it is a silent killer, and that is because it can often go for a very long time without the person who is hypertensive actually feeling any symptom. So people can go months and even years without feeling any symptoms. But you would notice that some of the symptoms that I'm going to mention, they would always occur in very severe hypertension where the blood pressure has gone very high. So it's important to keep an eye on those. And the only 100% way to actually tell if you're hypertensive is by having your blood pressure checked. This can always be checked in a pharmacy, at home, or you go in to see your doctor and then have it checked. So one symptom that most people who are hypertensive complain of is headache. So this headache might be dull or throbbing, and it is worst in the morning when you wake up. And headache is occurring because there is so much pressure in your brain. So another symptom that can occur with very high blood pressure is shortness of breath. And again, like I said, this one occur in very severe hypertension. And another symptom is feeling of fainting or dizziness, and this is because this high blood pressure is affecting blood flow to the brain. So another symptom that can occur with high blood pressure is nosebleed, and this is because blood vessels in the nose, they are very delicate, and with this blood pressure being so high, these vessels can rupture. Other symptoms that are associated with hypertension is confusion, nausea, vomiting, shortness of breath, abnormal heart rhythm, just so many things that can actually indicate that something is wrong. So most times the small symptoms that we ignore can always signify big things that are happening inside our body, which is why it is important to always have these things checked out again. So to conclude, high blood pressure has been linked to so many health complications. We go from stroke, heart failure, just so many things that can go wrong with uncontrolled blood pressure. So it's important that we have it checked. These things can always be checked at home, the nearest pharmacy to you, in your doctor's office. So it's important to know what your blood pressure is. Thank you so much for watching to this point, and I encourage you to share, subscribe to the channel to get more health content like this. Thank you. Bye bye.